There's been a lot of advances in treating melanoma, so what we're trying to do is figure out what's the best way to prevent the growth or progression of melanoma tumors. And there's signaling pathways that activate the growth of melanomas, and you can think of it almost like a water bottle, right? So the idea is this is the signaling pathways that activate melanoma, and what we're doing with most of our therapies is going from a gush to a trickle. So we inhibit the signaling so that we get to be a trickle as opposed to a gush or growth of cancer cells. But our thought was, what about instead of using that approach, about pinching off the bottleneck so that the cancers can no longer grow? So our work for the last 15 years has been identifying bottlenecks in melanoma growth and identifying how to target them. Melanoma is probably it's the number one cancer we see at UC Irvine, and that has to do a lot with our sun and our environment here, which is beautiful, but also increases the incidence of skin cancer. So about half of patients with melanoma have mutations in the BRAF gene, and our therapy that we're developing will specifically treat BRAF mutant melanoma tumors. I've put out 2 slides of an example of what happens when you treat these human tumors with our drug. So in the top slide over here is when you treat it with the vehicle, and you can see that the tumor cells are purple in color and that the center of the tumor is filled with these purple cells. However, when you treat it with our drug, what you find is that there's only a rim of purple cells remaining around the edge, and all of the center of the tumor is turned pink, and that's dead cells. So by targeting the bottleneck, we've basically destroyed the center of this cancer tumor within the mouse. I treat patients, and of course, as a dermatologist, the thing we always worry about is melanoma. Once it starts, it grows so fast. So the idea is how can you block the growth of early stage tumors? And we think the therapy that we're developing is going to be more beneficial for stage 3 melanomas, where we don't really have a great treatment for at the current time. So right now, we've gotten to the point where we've developed a drug. So we identified this protein RhoJ that we think is a bottleneck. We developed a drug that binds to it and inhibits its function. And with the help of the ACC, we were able to actually test the drug in human tumors that we put into immunocompromised mice and look at the effect of the drug on the growth of the tumors. So this preliminary data was critical for a grant application we sent in that we just learned is going to get funded by the National Cancer Institute. Thank you to the Anti-Cancer Challenge for the funding, which really helped us get preliminary data that have allowed to transition our project from just a concept or an idea into an NIH grant and now hopefully a new therapy for patients with melanoma.